Artificial intelligence is rapidly transforming countless industries, and healthcare is no exception. This powerful technology is poised to revolutionize how we diagnose, treat, and prevent diseases. Understanding AI's role is crucial for anyone interested in the future of medicine. AI refers to computer systems that can perform tasks typically requiring human intelligence. In healthcare, this means analyzing complex data, learning from patterns, and making informed predictions. Its potential to enhance patient care is truly immense. One of AI's most significant contributions is in improving diagnostic accuracy and speed. AI algorithms can analyze vast amounts of medical imaging data, such as X-rays, MRIs, and CT scans. They can identify subtle anomalies that might be missed by the human eye. This capability leads to earlier detection of conditions like cancer, enabling more timely interventions. AI also assists in pathology, quickly sifting through microscopic images to detect disease markers. This precision significantly enhances diagnostic reliability. The process of discovering and developing new drugs is traditionally lengthy and incredibly expensive. AI is dramatically accelerating this critical phase. It can analyze molecular structures and predict how compounds will interact with biological targets. AI helps identify promising drug candidates much faster than conventional methods. It also assists in optimizing drug design and predicting potential side effects. This efficiency can bring life-saving medications to patients more quickly. Personalized medicine tailors treatments to an individual's unique genetic makeup, lifestyle, and medical history. AI is central to making this vision a reality. It can process and integrate diverse patient data, from genomics to electronic health records. By analyzing these complex data sets, AI can predict which treatments will be most effective for a specific patient. This approach moves beyond a one-size-fits-all model, leading to more precise and successful therapeutic outcomes. AI-powered robotics are increasingly being integrated into surgical procedures. These robots enhance precision and control, allowing surgeons to perform minimally invasive operations with greater accuracy. They can execute intricate tasks with unwavering steadiness. While AI robots assist, they do not replace the surgeon's expertise and judgment. They act as advanced tools, augmenting human capabilities and improving patient recovery times. This collaboration elevates surgical standards. AI also plays a vital role in public health and population management. It can analyze epidemiological data to predict disease outbreaks and identify at-risk communities. This foresight allows healthcare systems to prepare and allocate resources effectively. By understanding disease trends and risk factors, AI helps in developing targeted prevention strategies. This proactive approach can significantly reduce the burden of illness on populations. It optimizes resource distribution across healthcare networks. Despite its promise, the integration of AI in healthcare presents challenges. Data privacy and security are paramount, as AI systems rely on sensitive patient information. Ensuring robust safeguards is absolutely essential. There is also the potential for algorithmic bias if AI models are trained on unrepresentative data sets. This could lead to disparities in care for certain demographic groups. Human oversight and ethical guidelines are crucial to mitigate these risks. AI is not intended to replace healthcare professionals, but to empower them with advanced tools. The future of medicine will involve a synergistic partnership between human expertise and artificial intelligence. This collaboration will drive innovation. For students, understanding AI's impact on healthcare is vital for future careers. The field demands interdisciplinary knowledge, combining medical science with data analytics and ethical reasoning. Embrace this exciting and evolving landscape.